Here is tonight's meeting agenda. Stay tuned. The Board of Supervisors meeting will begin shortly.
Call this meeting of the James City Service Authority Board of Directors, regular meeting to order. Good evening, Mr. Powell.
Evening.
Enough.
It's okay.
Sorry. Would you mind calling the roll?
Ms. Adler.
Here.
Mr. Eisenhower. Here. Mr. McGlennon.
Here.
Mr. Hippel.
Here.
Ms. Larson.
Here. We have no presentations this evening. Do we have any public comment?
No, ma'am.
Okay, thank you. That brings us to the consent calendar. If there is a motion to approve the consent calendar, it's minutes adoption.
I'll move.
Thank you. All in favor?
Aye.
Thank you. Any opposed? Motion carries. We have no public hearings this evening. We have one board consideration, contract award, White Oaks area water main replacement, $5,204,819,000. Mr. Powell?
Thank you. The resolution before you tonight awards the contract for the White Oaks area water main replacement. This project includes the White Oaks, Indigo Park, Jamestown Farm, and Canterbury Hills subdivisions that consist primarily of 2, 4, and 6-inch water mains that were installed in the early 1970s. These lines are undersized based on current standards. They're insufficient for fire flow, and this area also exhibits an increased number of breaks in the last few years. The project will install approximately 21,000 linear feet of new 4, 8, and inch water lines. All impacted roadways will be repaved after construction, and other disturbed areas will be restored to their original condition. This project was bid using PVC pipe with an alternate using ductile iron pipe. While either would be acceptable for this project, ductile iron is required in certain circumstances under our design standards, such as mains over 12 inches or installations where we cross utilities. Due to the work that this project is being completed in a previously developed area, and it will also cross other utilities, staff is recommending the alternative bid, the ductile iron, for this particular project. And based on the low bid, the project will still be under budget using the alternative bid. I just would add one last thing about this project. This is a relatively large neighborhood replacement project. It's an 18-month construction schedule. And while we will do everything we can to minimize disturbance and impact to the neighborhood, there is going to be some disruption. And I just do want to make sure that everyone understands that before we get started. Project of this nature, there's going to be some disruption. Having said that, staff recommends approval of the resolution awarding the bid in the amount of $5,204,819 to Henry S. Branscombe. Happy to answer any questions that you might have.
Questions for staff?
Resolution.
Thank you. Mr. Powell, call the roll, please.
Ms. Sadler?
Aye.
Mr. Eisenhower? Aye. Mr. McGlennon?
Aye.
Mr. Hippel?
Aye.
Ms. Larson?
Aye. With that brings us to board requests and directives.
A couple of quick things, if you don't mind. And first of all, glad we are getting this project underway. I think it's been decades in the making, as I recall. I noticed on the dashboard that you provided us that there were an exceptionally large number of service calls in the week of January 4th, larger than any other week that I could see on the dashboard? Any explanation for that?
That was due to the bills that went out late.
I see.
So we were inundated with phone calls because
Right.
people got their bill after the due date. So there was a lot of confusion, and so that was the reason for that.
And on the matter of bills, have we started to see any applications? Are we aware of a number of people who are trying to take advantage of the CARES Act funding?
I've inquired about the numbers that have applied, but that information is not available on a locality basis yet. So I'm hopeful that people are applying, but I don't have the numbers yet. I will say that that we have received word that program has been extended. So hopefully that will give us additional opportunity to help and assist more customers. But yes, that's where we are at this point. I mean, I will say on the billing issue as well. I think that there's probably still going to be some lateness to the December bills that just went out. They were mailed on January 4th, and I know some customers haven't gotten them yet. So they really should have received them by now. So I'm not really sure why we're having this problem again. Some customers have received them, some have not. So I think that there's some additional investigation we're going to need to do on that.
I get mine electronically, so I really need to
Yes.
to not get the paper one anymore, but I guess I just hadn't checked the box yet.
Okay.
I have not received my paper one yet. So, and I was one of those that got it
Okay,
very
okay.
late. So, yep. Were
But
there,
we won't call you about it then.
Okay, well, that's okay. You're perfectly justified if you do. I do want to reemphasize, we're not going to be charging late fees for either the November or December bills. So for customers who are worried about that, that's not going to be an issue.
so the only question I had was, you brought it up earlier about the neighborhood and the 18. What's your plan of communication with those neighborhoods?
So far, for the most part, we've been communicating in writing just because of the, COVID-19. We will continue to do that. Our plan was, once this bid award was approved, we will meet with the contractor, come up with a construction schedule, and then we'll send something out in writing to all the property owners in the neighborhood outlining what the construction schedule is and what the impacts that they can expect to see.
I was going to comment, though, that totally it's any of JCSA's fault, because I've gotten about a half a dozen bills that have arrived in the mail well past the due date, and you're having to track and pay things online because you can't.
Maybe I should take this opportunity to plug the electronic billing. I was actually surprised. Almost half of our customers do get their bill electronically. It's over 11,000 people do receive their bill electronically. That might be a good option for some folks who are still getting.
That brings us to the general manager's update.
I just had a couple things. First of all, Mr. McGlennon, you mentioned the dashboard. We did get it out before the meeting, but the dashboard, given that our meetings have been moved up, the dashboard probably won't be available when the board packet goes out, but should be available by the time of the meeting. So I just wanted to say that. And then the other thing I wanted to just mention is that the water line, the College Creek water line has been installed. It still needs to be tied in and some restoration work, so it's not in service yet, but the installation is complete.
All right, with that, if there is a motion to adjourn until 5 p.m. on February 9th, 2021 for our regular meeting.
Motion?
Mr. Powell, if you'll call the roll.
Sadler?
Aye.
Mr. Eisenhower? Aye. Mr. McGlennon?
Aye.
Mr. Hippel?
Aye.
Ms. Larson?
Aye.
All right, thank you.
Thank you.
Okay, I'll go ahead and call to order this meeting of the James City Board of Supervisors regular meeting on January 12th, 2021. Mr. Stevens, would you call the roll, please, sir?
Yes, sir. Ms. Sadler?
Here, sorry.
Ms. Sadler represents the Stonehouse District and is vice chair to the board. Mr. Eisenhower?
Here.
Mr. Eisenhower represents the Jamestown District. Ms. Larson?
Here.
Ms. Larson represents the Berkeley District. Mr. McGlennon?
Here.
Mr. McGlennon represents the Roberts District. Mr. Hippel?
Here.
Mr. Hippel represents the Powhatan District and is chair of the board. Sitting to my right is Adam Kinsman, County Attorney, and I'm Scott Stevens, County Administrator, and it's my pleasure to be clerk to the board. Mr. Chair.
Thank you, sir. All right, may I have a motion to amend the board agenda to add 2 additional discussion items for closed session, including the discussion and consideration of acquisitions of real estate properties for public use where discussed in an open meeting would adversely affect the bargaining position or negotiation strategy of a public body, especially real estate property at 101 Mounts Bay Road and 297 Neckerland Road. All right, Stevens, would you call the roll, please, sir?
Sadler?
Aye.
Mr. Eisenhower?
Aye.
Ms. Larson?
Aye.
Mr. McGlinnan?
Aye.
Mr. Hippel?
Aye.
Motion carries.
All right, next we'll have a moment of silence, and after a moment of silence, we'll have the Pledge of Allegiance. And if I could ask Mr. Henderson, would you mind leading us in the Pledge of Allegiance tonight? Thank you, sir.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Mr. Henderson. All right, next, our presentation is, who is the doctor?
Yes, sir. Dr. Dwamena is online, Mr. Chair, and I think ready if our folks in back can tie her in.
Hello?
Hello, doctor, you there?
Yes, I'm
Welcome.
here. Hi, how are you?
Very good today. Thank you very much. How are you doing today?
I'm staying busy, but glad I could come and speak to you all this evening. I have a presentation to share. See if I can share my screen here.
There you go, we see you.
Okay, so can you see the screen?
Yes, ma'am.
Okay,
Yep.
so I'm discussing the vaccination update for Peninsula District. I am the Health District Director. So as we all know, we are in a pandemic state, substantial community spread. The case incidence and percent positivity rate specific to James City County is elevated, not as elevated as the region, but you know, again, it's increased across the state. So that's where we're at. Specific to our vaccination campaign, we are currently in phase 1A. Almost 1,000 people have been vaccinated through our local health department clinics alone. When we add on the efforts with the local health systems, that number is a little bit over 5,000. Fire, EMS personnel, and long-term care facility vaccination has begun and is ongoing, and that began earlier this month. We have 2 sites that are up and running. That's at our Victoria site in Hampton, and then our Peninsula site currently is only at J. Clyde Boulevard. There are plans to open a site at our Ironbound location next week, and we are currently in the works for setting up a site in York County at a local senior center. So that we're anticipating should be up and running before the calendar month is up. We are coordinating plans with Riverside and Centera for larger scale vaccination events. These events, we are looking at several locations specifically in the Peninsula. Busch Gardens and CNU have been sites that have been mentioned, and we're canvassing those sites and working out the logistics. No dates have been set for that. We have standing meetings with city and county administrators as well as emergency planners, and that is conducted either by myself or my emergency planner, Kevin Pierce, who is the lead coordinator for the vaccination campaign. And our planning with local health systems is ongoing, especially with Riverside Health Systems. They've been very instrumental in helping us get the vaccine out. I'm sure most of you are familiar with the priority groups set up by the CDC and adopted by VDH. The first priority group is set into 3 tiers, A, B, and C. A is primarily the healthcare workers, long-term care facility residents, and staff. This includes the acute healthcare workers, EMS, outpatient providers, as well as the long-term care residents and staff. So the approach that our district has taken is focusing on the health department clinics, which at this point are relatively small compared to some of the hospital systems, but we are going to augment that in the number of sites as we expand. The health system clinics, those clinics have been set up and established by the respective health systems for a vaccine that was distributed directly to those health systems to vaccinate that priority group. We have also coordinated and requested health systems to allocate vaccine to their outpatient practices to also help facilitate vaccination of those providers. We are also encouraging providers and practices that can serve as points of distribution to request direct supply of vaccine. That can either be through us where we reallocate, but it would be more convenient for those facilities that can store the vaccine inventory and vaccinate their own staff to register through the CDC agreement and some paperwork that is required for them to serve as their own pods of distribution. In that instance, they will be able to facilitate vaccination of their workers. And the commercial pharmacy partnership is a federal partnership that's established primarily with CVS and Walgreens. We, at the district level, with the assistance of the state, of course, identifying local pharmacies that we can partner with to help augment the remainder of the people who fall within this priority group. 1B, this is the second tier, frontline essential workers in congregate settings. These congregate settings include correctional facilities, homeless shelters. Frontline essential workers is a large category. The definition has evolved through several weeks, but for the most part, they include first responders, law enforcement, public service workers, teachers, as well as critical infrastructure, which again is a very broad category. The approach that we have set up is similar to our 1A groups in the sense that we will have the health department clinics. We will continue to rely on health systems to maintain and continue their clinics, as well as allocating their supply to their outpatient practices. Large site clinics, we are coordinating plans with localities as well as health systems to set up larger site clinics that would primarily target the frontline essential workers. Similarly, those facilities, whether they be medical practices or employers that have occupational health divisions that can serve as points of distribution, having them signed up, set up to receive vaccines so that they can perform their own vaccinations of staff and eventually patients who fall within the demographic group. 1C, again, this essentially is the category of essential workers that may not fall into 1B, as well as those age 65 and up, and general population with comorbidities. This category is evolving. There's been recent reports of changing the age demographics. So this categorization that I have is based on what is currently set in place, but obviously this may be subject to change, and this presentation may be outdated before the week is out. But for as of today, right now, this is where it stands with 1C. The approach, pretty much expanding what we are already we're doing with 1B. This again is subject to change based on the additional support that we may get from the state, and different discussions about ways that we can expand and stand up larger scale clinics for longer periods of time. So this approach is what we currently are considering, but again, when we get to 1B and 1C, that this can be modified, and I anticipate that it will as we get more information and support from the state. So as I said earlier, clinic sites that we have standing and operational are Victoria Boulevard and at Clyde Morris. The Ironbound site is anticipated for a opening on the 20th, and the Yorktown Senior Center is pending. Currently, we are setting up appointments. The scheduling system that the state has set up with us, called VAMS, has been a challenging, to say the least. Some districts have better luck with it than others. Some have abandoned it altogether. We have not had much success with the scheduling through VAMS. So VDH is developing another system called PrepMod that should streamline the scheduling. What we are doing right now is we are performing outreach to identified facilities, and then also based on the calls and requests that we're receiving into the health department. That will improve, and that will change once we get a more reliable, consistent scheduling system up and running, so that we will be able to schedule people more quickly and more efficiently. Currently, right now, with the staffing that we have, the 2 sites that are up and running are operating 3 days a week, Monday, Wednesday, Friday, but there are plans to expand. What that expansion looks like is going to depend on the staffing that we ultimately have. How we are setting up the scheduling has been facility-based. The outpatient practices, the physician practices that have either been identified or called into the health department, those people, again, because of the challenges with the scheduling system, they have been contacted and directly scheduled. That is our current mode of scheduling, but as I said, that will likely change once we get VAMS up and running, and as we shift over towards 1B and start addressing the general population. So the challenges, the most immediate challenge that we're having is getting the staff to vaccinate. At the health department, the number of vaccinators that we have is limited, and we have had to modify clinic services in order to accommodate the vaccine clinics. The plans that we have to augment our vaccinator staff include use of EMS, as well as school nurses, nursing students, pharmacy technicians. So there's a pool of staff that can be trained to be vaccinators, and we're looking into all of those options. Currently, we have our staff in EMS that we have accessible to at least start with those efforts, and we will be adding on staff as people get trained and signed off. The quantity of vaccine that we receive weekly allocations. Health systems receive their own allocation. We receive a certain allocation. The allocation that will go to facilities that have been designated as their own points of distribution, they will have a separate allocation. The amount that each pool gets, the health systems, the health department, and those practices, that is contingent upon how much vaccine the state gets. And so that number varies, and then they split it up. So we have on average been receiving several hundred vaccine, and the orders that we put in are weekly orders. And then once we determine what we actually get, because it may not always match up, then obviously we use that to conduct our vaccination efforts. As I mentioned earlier, VAMS has been a challenge for us, but we're expecting that will soon be resolved with the addition of PrepMod. The vaccine uptake, obviously we want to vaccinate as many people as possible, and it's important that when people are scheduled that they come in, and that we're able to keep those schedules full, which the schedules that we have set have been full, so that has not been an issue. Another challenge that will be coming up and that we are preparing for are for those people who are coming back for their second dose administration. And there is discussion about how we address that. That will be dependent on the type of vaccine that the person is given, but also if they come back, when they come back for their second dose, how that will look and how we will work that out logistically. We're still finalizing some of those plans and developing that. So as I said earlier, we're in phase 1A. We are looking at a phased approach into 1B. And what makes this different than actual shift into 1B is that as we phase into 1B, we will still be vaccinating 1A. That will still be the main priority group of the health department until we can get a sufficient amount of 1A group vaccinated, and then we can put more effort fully into 1B. This phased approach into 1B will include the large scale events so that frontline workers and some of the elderly population can start to be vaccinated. And this will have different formats to it, from larger scale events to even some of the health department clinics or some of the health system clinics. It's important that we ensure equitable access to vaccine, and that is throughout all of the localities in the peninsula, as well as the demographic groups. Scheduling efficiency is crucial for us to be able to not only have and receive the vaccine, but also make sure that people are vaccinated and that there's a smooth process of them getting vaccinated and then them being able to come back and receive that second dose. The augmenting our capacity to administer vaccine is related to the supply chain, which we don't have as much control over, but also augmenting our capacity with our vaccinators and the number of sites that we're able to stand up, or number of events that we're able to have. We are streamlining communications with public and locality leadership. We are very much aware of the confusion and frustration that is going on out into the community. So we are updating our phone tree so that when people do come in, call into the health department, it is less frustrating and confusing. We have also updated our website to let people know where we are in the phase and what that means. And finally, we are continuing to coordinate with local health systems and localities to provide vaccine as quickly, efficiently, and safely as possible. This is a coordinated effort. I can't stress that enough. The assistance of the health systems is really critical for us to finalize and complete phase 1A as we transition into 1B and eventually into 1C. Looking forward, the vaccination events are going to be very important and crucial to our ability to vaccinate people in mass quantity. The state is looking at enlisting support from the National Guard in having clinics. What this looks like, when this happens, I don't know. This is just something that we're currently looking into. Resuming access to community testing and resources. Many districts, including our own, has suspended the community-based testing events that we had scheduled set up. We are referring people to pharmacies or to other places that are still conducting the COVID testing, but our hope is that at a certain point we will be able to resume some of those events, and we will continue to have regular meetings with school superintendents, and we will also have a vaccination update with them as well this week. So this is the website for updates. This is the vaccination hotline number that we have. This number receives messages, so you'll likely have to, if you don't actually get a person, you will leave a message, and those messages are answered daily, Monday through Friday. I will pause to take questions.
Questions?
Possibly read out that phone number for people to call. We don't have that in front of us.
Oh, okay. Sorry, I will put that back up. 757-594-4796.
I do have a few questions. Do you want me to go one at a time, or you may read them all out at once?
One at a time is fine.
Okay, so I have received a few phone calls from some primary care physicians, a couple of them in particular that are not affiliated with Centera or Riverside. They're unable to obtain updated information. Two of them that I've spoken with have not been able to get information as to when they themselves will be able to be vaccinated as a healthcare provider. And then there are also the doctors that I spoke with are wanting to know when do you look for these primary care offices that may not be affiliated with Centera or Riverside to be able to get the vaccines?
So the number that I posted, hopefully that's the number that they're actually calling, because some of the complaints or the concerns is related to them not calling the right number. The second point is that as far as setting an actual timeline of when people can be scheduled, once we expand our clinic sites, then we can provide more information as to when people will actually be scheduled. The scheduling of 1A providers is ongoing. So we do call back, and we have started calling back to give people updates of when their turn is, because we don't have we have a list of people that we're actively calling, but it's several hundred outpatient providers. So some of those providers, they call in, and then we gather their names. If these are providers that can serve as vaccinators themselves, we take them through the process to be points of distribution if they want to do that, and that's more so for larger practices. So the way that these practices are identified are either them calling into the health department, or these are practices that we have identified.
Right, and and I think the other question they were asking me about is the storage. Are they going to be able to receive the Moderna vaccine? In terms of how it's stored and their capability of storing it, the doctor's offices.
Well, that depends on what equipment that they have to store the vaccine. So if they want to be a point of distribution, so essentially if they want to be able to store vaccine and be able to administer vaccine, there's a provider intent form that they need to complete, and that's state mandated. There's a provider intent form that they need to complete, and there's also some agreement. When they call into that number, if they make that request that they want to be a point of distribution, then we can direct them to that, or that information may also be on the website if they themselves want to actually receive Moderna vaccine directly.
Okay, so Moderna is available, so to speak?
Well, so to speak, I mean, the availability of Moderna is determined by the state, if how much of it is available, but I mean, a Moderna vaccine is being ordered, yes.
Great, that's all I have for now. Thank you so much.
You're welcome.
Two questions I have for you. First of all, when we talk about the categories 1A and 1B, you mentioned, I think, 1,000 at your clinic and 4,000 from additional places have been recognized already. You know how many people in our health district are in the 1A? In other words, do we have an idea of how big that population is? And same thing for 1B. You mentioned that was a much larger population, but you know, in order to have an effective plan on how you're going to administer vaccines, I think, and get from 1A to 1B, you probably ought to have some idea on that. Is that a readily available number for each one of those categories?
The estimated number for the providers and the facilities that encompass 1A is over 20,000 people. Again, the 1A group also includes long-term care facility residents and staff, and those vaccinations are being conducted primarily through pharmacies. I don't have that number readily available. So the 1,000 that I quoted, and then the 5,000 that the additional 4,000, that is based on the vaccine administration that has been updated in the vaccine immunization system.
Okay.
But I don't have the number readily available for how many, where the commercial pharmacies are at, because they're operating through the federal partnership. So I don't have that number readily available. The 1B group, I don't have an exact number because it is a broader category because it's encompassing more people. It's encompassing pretty much all of most of the frontline workers, as well as critical infrastructure that ranges from school teachers to postal workers to food and agricultural workers. So where we are gathering, some of those numbers are coming in, and the state is helping us with that and gathering that data.
So basically, you think there's about 20,000 in 1A in our district, and we really don't know how many, but significantly more than that, obviously, in the 1B.
Correct.
When do you, and you were indicating that you thought there might be a transition. When do you think that the first of the 1B transition would start? How soon? Are we looking at something like February or March or April? I mean, do you have any feel for when that transition, we would start working on some of the 1B folks?
I hope to start working on some of the 1B before the end of the month, within the next 2 weeks.
By the end of January, starting some of it, okay.
Yeah, but again, the approach is going to be a phased approach because we can't afford to just rely on getting all the way through the 1A. So we will be also vaccinating 1A groups in tandem with 1B. It'll be a gradual phased in process. And as the vaccine supply, warrants, then we'll be able to ramp up our efforts into that 1B category. But the duration of vaccination for 1B, that again, that's going to span weeks, possibly.
And I guess my last question for you would be, given 1A and the fact that you've got a pretty good dent in it already, what is your best guess for when you would essentially complete the vaccinations for 1A? Is that going to be stretched out over several months, obviously, or do you anticipate that would be a shorter term completion?
I'm anticipating that to be shorter, not several months. I hope to have that for us to be complete with 1A well before March. But again, the supply that we get, it's going to be contingent upon the vaccine supply that we receive. And we are making requests for larger amount of vaccine. The amount that we actually receive in our allocation and the amount that we're able to coordinate with other entities receiving vaccine is going to influence that timeline.
Hi, good evening. Thank you for being here this evening. You said that you've given 1,000 vaccines. How many have you received?
We have received, I want to say, on average for Peninsula, we've been receiving at least about 600 weekly. So we have probably about 2,000, somewhere in that range.
2,000 total or 3,000 or two?
For Peninsula.
Right. Is that 2,000 number minus the 1,000 that have been given, or is there 3,000 total that have come in so far?
No, not 3,000, 2.
Okay. And then have we contacted EMS, school nurses, et cetera, to try to move along the process? You said at some point that you would need their help in trying to get more vaccines into arms. Have they been contacted? Has that process started?
That process has started. The operational medical directors are signing on to provide oversight of EMS vaccinators, and the school nurses, the request has been made for school nurses to initiate their training so that they can serve as vaccinators as well.
Have we had to get rid of any vaccines that were taken out but were not used?
There was one instance of a dose that was not able to be used. The way the doses are set up, you have to, once you open the vial, you have to use several doses per vial. You can't have anything left over. So that was an instance of a person not showing or going to another site. So we weren't able to retrieve that dose. But other than that, no dose has been wasted or thrown
And then
out.
I've heard on the news of recent that there has been a little bit of discussion by some doctors that perhaps the thing to do is not to have this tiered system because it's taking quite a bit of time to get the vaccine out. And so perhaps the thing to do is to just do these large clinics and say, please come get your vaccine, because by starting with the elderly population, you are trying to reduce the amount of deaths, But if you have the youth that are asymptomatic and spreading it, if you get them vaccinated, that'll also help stop the spread. So has there been any discussion in Virginia about perhaps, getting innovative and maybe looking at how we can start getting more people vaccinated? Or is it just strictly been about keeping this 1A, 1B, 1C process going?
The directive at the district level has been to implement the prioritization groups. There may be discussions going on at the state level regarding that, but currently that's our directive is based on the prioritization groups.
And the one thing yesterday, I noticed there was a big push on social media that said that you could, VDH had done that you could sign up and then you would receive a text message when it was your time. I think it was, and I did have a little bit of concern over that because I know, like for me, I have an 80-year-old father who does not have a cell phone. And so, I mean, I do think there's probably more people that do have cell phones now, but we are a population in James City County of older folks, and I'm not sure all of them have cell numbers to receive a text, and it was text only, you had to have a number that could receive a text. And so I just wondered, moving forward, if there might be some other communication things that might happen, that another way to notify people who may not have a cell phone, and if that had been discussed.
That has been discussed. Nothing has been developed. That format of text alerts, that was developed and linked, I believe, to that scheduling system that VDH developed. At the district level, we obviously aware that not everyone, a lot of people don't have cell phones, just similarly, a lot of people don't use internet. So we have expanded our communication beyond relying on the internet or with text messaging, and that is through either disseminating information through certain groups or organizations, or doing direct outreach through facility providers. But that communication is still being developed to determine what's going to be the most efficient way to get that information out to the public.
And then, I'm sorry, just a quick follow-up. You said that you are requesting 600 a week. Is that the max that can be requested?
Well, that was initially what we had the capacity for at the time. We are currently getting refrigerators and freezers so that we can store more vaccine. The amount of vaccine that the health department requests, and that most of the health department's request, is based on our ability to store that vaccine on site. So that number isn't reflective of the amount of vaccine that the entire health district will actually receive, because that number is based on our request, the request of the health systems in the district as well.
Okay. Do you know if prior to the vaccine being released, if there was any movement on the state level to ensure that the local districts received more refrigerators, et cetera, possibly with CARES Act money that came down from the federal government? Do you know if there was any, did you receive any additional refrigeration prior to the vaccine coming down?
We placed orders for the refrigeration and the supply, and we're just starting to get that equipment. So once we get that in place, then we'll be better positioned to store more vaccine on site.
Thank you.
Dr. Dwamena, is correct?
Dwamena, yes.
I think a number of the questions that I would have had been asked by my colleagues, but I would like to know a little bit about the CDC apparently today is announcing that they are encouraging a movement to 65 in 1B. Do we anticipate that the state will follow that guidance? Because as I understand it, the state has flexibility in terms of what they're doing.
So that is obviously a recent development. So the state is determining if they're going to adopt that, if they have the capacity to adopt that. Once you change the prioritization group, then you have to make sure that you can meet that demand and the amount of vaccine that's going to be required to vaccinate that group. So in the past, VDH has been fairly consistent in adopting CDC recommendation. So I know that the discussions are being had about if and when they're going to adopt that and what that is going to look like.
Do you have any idea as to why many health districts have already moved into the 1B and we have not yet?
Well, transition into each phase is multifactorial. It starts with the resources of the local district, and that is related to staffing, funding, also the partnerships with local health systems. All of those play a role, as well as the partnerships with commercial pharmacies and local pharmacies. So if those systems are already in place, especially if those partnerships have already been established before the pandemic or before the vaccine rollout, it is much easier to facilitate a more coordinated effort to push through 1A when you have those systems in place. So there's several factors. Different districts are in different points in their phases, and it definitely is a reflection of resolve or work intent at all, but a lot of it is really just resource based and the ability to mobilize in a large enough number.
I wonder if I could just get a little bit of sense of understanding. On the Virginia Department of Health website, there's a map where you can go on, move your cursor over each individual locality, and it gives you a number of vaccinations that have been carried out. And I looked this afternoon for James City County. It said something like 1,350. That reflect the vaccinations given by the health department, or is it a cumulative number? Is it a reliable number?
It is a cumulative number. The number is based on the vaccinations that are entered into the system. And because of the various challenges with uploading information into the system, it is not up to date or as reliable. So that's why obtaining the actual numbers from the local health district has been more reliable and consistent. But the dashboard is helpful to give a general overview from the state level, but it isn't something that is going to be an up-to-date reflection of how quickly we're vaccinating.
So I may have missed this at the very beginning. When you gave us the numbers of 1,000 and 5,000, were those for the district or for James City County?
That was for the district. For the health district, between the two.
Have the numbers broken down by locality for your district?
Well, the dashboard breaks down by locality our numbers, because the people who are signing up, we're basing it on the site. So the people who are coming to our J. Clyde site and our Victoria site, that's how we're calculating the numbers. We haven't been collecting data by specific locality. But we do have plans to do so, but we haven't done that as of yet.
So when you give shots there, you're not, obviously you know the address of the person, but city or county.
I'm sorry, you went in, could you repeat that?
Yes, you know what, you know the address for the person, I'm assuming, right? but you don't necessarily know which jurisdiction they live in. For instance, in this area, Williamsburg's got the same address for people who live in York, some portions of York County, James City County, and the city of Williamsburg. So you wouldn't necessarily have that distinction.
Demographic information is collected. I can't speak specifically to the level of detail that is obtained at the time of registration. I can garner that information and return that to you, but I can't tell you exactly at this point.
Well, thank you very much for the work that you're doing, and hopefully we'll be able to continue to see improvement as the systems become more robust and we get more experience with all this. So thank you very much.
Thank you.
Thank you. Doctor, a couple of questions, or maybe more of a statement. And, you know, seems to be everything we're looking at in the news and we're hearing and all that, you know, we knew this was coming. And I'm not pointing this at you, but we knew this was coming. And it seems like we didn't plan well enough with our emergency responders and everyone else in order to implement this in a faster pace. It seems like to me, only me, that we're behind where we should be at this point as far as getting the vaccines out. And it seems like that, or I've heard that if we don't get X amount out, then they're going to go other places. So it tends to worry me that if we're not getting enough out now and we continue this pace and we don't become better at what we're doing, then we may lose the chance of having more in the future because they may go to other places that are getting them out quicker in order to have maximum capability across the state, not necessarily for a jurisdiction. So it could end up, if we don't pick up the pace, it can end up hurting our community as far as being vaccinated quicker than other communities. Would that be a correct statement?
No, I don't have any concern that we will not be able to utilize our vaccine or that we will be penalized for the quantity of vaccine that we're pushing out. I mean, we definitely need to increase and ramp up our output. That is a given, and that's, you know, not specific to just our district. So we definitely need to do that. The allocations that we request are based on our ability to store, but also our ability for output. So we definitely have room for improvement, and we will be ramping up our output. But I'm not concerned about us being penalized for, you know, for not putting out the same amount of vaccine as another area or another district, because we do have, we are developing plans to increase that output and making sure that if we have, once we do have the, as we increase our capacity, we will hopefully get more vaccine as well. But I'm not concerned about that at this point.
Okay, so hearing that, understanding that we are behind, but we're going to pick up the pace, and you have, I'm imagining you have a plan in place starting tomorrow to pick up the pace with vaccinations. Would that be a correct statement?
Yes, I mean, the plans that we are working on is obviously contingent upon our partnerships, but the implementation of that plan we should start seeing within the next week, one to 2 weeks.
All right.
But yes, the planning is actually ongoing.
Okay. Thank you very much, and I appreciate you taking some time tonight to explain what's going on and help us figure this out so that we can in turn get this out to our citizens and let them know that we're trying everything on their behalf to get as much information and as many vaccinations and as much help as we possibly can to the citizens of James City County.
I do have a follow-up, if I might, please.
One more.
Thank
Supervisor
you.
Sadler has a question.
Sorry. So I'm wondering, are you all getting information in terms of the comment that was made earlier about seniors might, because I know my 90-year-old parents, they can barely pick up their landline, much less text. I'll just say that. In terms of getting information to them, the doctors I've spoken with, they're inundated with phone calls and on when can we get ours, and majority of them that are calling are senior citizens. Have you all considered coordinating with the healthcare providers the information as it's coming through the pike so that they know what to tell their patients when they call? And if it is, a great deal of seniors that are calling, that would alleviate some of the lack of flow of information to folks. Would that be an avenue in terms of because they're going to have their phone number, they could call them. If they're up tomorrow, then that might be a way for them to communicate.
The improvements in communication with outpatient providers, that is something that all forms of communication we are improving, and there is room for improvement. The outreach to outpatient providers is a coordinated event between the health systems that have their outpatient facilities, but also the providers that we've either identified or have reached out to us. The questions regarding when are people going to receive their vaccine is a harder question to answer if they are in the 1B category. Even within the 1A category, making sure that enough of the 1A providers are actually getting their vaccine. So some of the questions as it relates to a specific timeline is a harder question to answer because we don't have we don't want to give a set date and then not be able to deliver. So the primary avenue of informing providers, if they are linked to a health system, would be through that health system. But if they are independent, freestanding offices, then the outreach to the health departments, we do have communications. We do have a communications and a hotline that when providers do call, we do provide them with the most up-to-date information that we have. So as I said earlier, we are currently developing different ways that we can communicate with providers and what that looks like beyond using the telephone and using the internet. We're still in development of forming better communication with them, but that's currently what we have right now.
One more.
Doctor, I had one question, if you would, for you, and it deals a little longer term. My understanding of the vaccine is that what the vaccine does is that it doesn't prevent you from catching the COVID virus, but that once you're vaccinated, and it gets into your body, it precludes or limits its ability to replicate, and therefore it protects you from the runaway influences of the disease. However, even though you're vaccinated, you can still have the virus, and you can still be, in my mind, I would think you could still carry it and spread it. So is it fair to say that even though you're vaccinated, it's possible that you could still be a potential threat to your neighbors and family because of being able to carry it, and that you'd still need to do the distancing and the mask wearing and everything despite of the vaccine? In other words, the vaccine is not going to be a panacea that magically we all go back to normal right away.
That is correct. The vaccine is not a panacea for resumption of pre-COVID activities. The vaccine minimizes the the complications related to COVID infection. It does not eliminate the virus. It has not been proven to eliminate a person's ability to still be a vector potentially of the virus, especially if they are not wearing masks or not practicing precautions. The efficacy, the initial efficacy of the vaccine is based on the early studies. As time goes on, this year, next year, and more people are fully vaccinated, we'll have a clearer sense of the longer term efficacy of the vaccine, specifically if boosters are required beyond the first 2 doses, and similar questions that, again, can't really be answered at this point because we're so early in the administration of the vaccine. But completing your vaccination series is not, or shouldn't be seen as a green light to then go and proceed as you were before COVID. That hasn't been proven to be an absolute at this point.
Thank you.
Hey, I want to thank you very much for attending our meeting, and keep up the good work and be safe out there.
Thank you. Same to you.
Thank you.
Good night.
Night. All right, next is our public comment session, and our first speaker is Peg Borman. Welcome.
Afternoon. Thank you, Mr. Chairman Hipple, members of the board. Gentlemen, I'm Peg Borman. I reside at 17 Settlers Lane in Lightfoot. Again, I'm coming to talk to you, or again, I want to thank you, first of all, for the Chairman's Award last month that was given to me. I'm deeply honored and I'm humbled by the fact that, and I hope that I can continue to live up to the accolades that I've been receiving. But I'm here to talk trash, and you know that I just love trash. There's so much of it that's out there right now, and there's so many people that could be picking it up. Instead, they're throwing it out. And but it's sad because we really it's accumulating right now. So, and I've had a lot of calls about it, and I think some of you might have received some calls about that also. But the commission is trying to put together volunteers, and I'm encouraged by this fact that the volunteers are willing to do that. Just go out and pick up the trash. The commission has put together a litter cleanup kits, as I mentioned back in the fall to you, and we want to loan those out to anyone that wishes to go out and volunteer and pick the trash up. And just give me a call at 757-565-0032. The commission has set a date, April 17th, that's a Saturday, in mid-April, for our annual spring cleanup date. We hope that we can implement this and be having volunteers out cleaning up the county at that time. It's not probably going to be the same as it has been in the past, but I'm sure that we can do this and keep everybody safe and get our county clean once more. The commission is continuing to meet monthly via Zoom on the first Thursday at 5:30. However, in February, we will meet at 5 p.m. For the Clean County Commission, and at 6 o'clock, we will meet at, for James City, Keep James City Beautiful. They will meet on the Zoom also. We invite anyone that would like to help make a difference to join with us, and you can go to the county website and fill out an application to be on our commission, and then you as a board can appoint them. There's still a need for a representative in Powhatan, but I am working on that. and I may have a candidate soon.
All right.
So at least I'm hoping so. Again, I want to stress that anyone that can't get involved as an individual and go out there and pick up the trash, they can work in front of their homes, in their parking lots, or wherever they live, and they can pick up the trash that's there because it's not going to pick itself up. And we do have the loaner kits, as I said, and we, on behalf of the commission, we appreciate all that you're doing, and as citizens of our county are keeping it clean, beautiful, and it's all of our responsibilities as citizens to be good stewards of the planet we call home. Thank you so much for your time, your interest, and your support for our commission. And if there's anybody that wants to have questions answered or whatever, please do not hesitate to call on me. Thank you.
Thank you. Next speaker, Chris Henderson. Evening.
Members of Henderson 101 Keystone. That certainly was a sobering assessment of where we are strategically and tactically with regard to the rollout of this most important vaccine. And it should be a cautionary tale to everyone with regard to the inefficiencies within a government-run system. That is why the private sector must be the ones to take the lead on this and put injections in arms. And that's the most important. As a leader in the Republican Party and as a thought leader within the conservative populist movement here locally, I want to condemn in the strongest possible terms the events, the lawlessness and the violence that occurred at our nation's Capitol on Wednesday. It is deeply distressing to me and members of the Make America Great movement to see these types of activities occur under our name and our banner. We renounce it and we reject it, we condemn it, and we ask that those responsible be held accountable for it. That being said, the concerns expressed by citizens both here in Virginia and nationally are valid, and the wounds and the hurt and the injury will not go away by sweeping it under the rug. This requires a thorough investigation so that all people can be satisfied as to the sanctity of our elections. And I am thankful that I personally know the individuals responsible, Diana Moorman, and the folks who work on our elections here in James City County, that we can have 100% confidence that our elections are free and fair. And James City County should be congratulated for that, and Diana should be congratulated for the way that she conducts herself. It speaks well of our community and the fact that as the bastion of freedom, where our nation was established, that we believe in the sanctity of our votes and of the rights as enumerated in the Bill of Rights. Our institutions are failing us in this country, and we are, as a society, under great duress. And I'm frankly scared for our nation, and I ask that each board member and each citizen pray for our nation, that we are able to hold things together because tensions are at an all-time high. It is simply not, we are not capable of being governed, or governing requires that citizens consent to be governed. And when we have a failure in government, it hurts all people. And so we need to be aware of what is going on nationally and how it might affect us locally, so that we are prepared to deal with potential events of civil unrest should, God forbid, they find their ways to our front door. We cannot kid ourselves that there is not an enhanced sense of frustration and anger within the broader community, where 50% of the nation believes that our president-elect is not duly elected. Changing topics, I do want to congratulate the county on a couple of projects that I think are of significance and importance. And that is the completion of the road widening and improvements at Centerville Road and News Road. I want to commend Henry Branscombe LLC for their work on that project and completing that in a timely manner and safely. That is a major improvement and much needed. I also want to congratulate Branscombe Inc. for their work on the Long Hill Connector, as those much needed improvements are helping to alleviate a significant traffic barrier and bottleneck in our local community. Next, I want to turn my discussion to schools. And this goes back to the notion that institutions are failing us. We simply have to get our kids back in school. I spoke about it last month. The situation is even more dire and more urgent. We must get our children back in school. We don't have an alternative. We must, again, agree and allow free people to exercise their freedoms in operating their businesses and living their lives, and trust our people to make decisions about their health and their businesses. Thank you.
Thank you. All right, next our consent calendar. There's nothing on our consent calendar, so we'll move right into our public hearing. And our first public hearing is our pre-budget public hearing. Ms. Day.
Chairman, members of the board, the purpose of this public hearing is to invite comments and suggestions from our citizens for the upcoming county budget. The comments and suggestions made at this pre-budget public hearing will help guide staff in preparing a budget proposal for the board's consideration in May. No board action is being requested at this time.
Thank you. Any questions? I'll go ahead and open up the public hearing, and we have 2 speaker cards. Mr. Jay Everson.
Chairman, congratulations for your new position. Eisenhower, you did a great job when you were the chair. I'm here today to talk about the school CIP. Latest future will have virtually no significant increase in population at any level over the next decade. In specifically speaking, we'll start off with the high schools. They're proposing to spend $2.5 million on Jamestown High cafeteria expansion because of overcrowding. Now, I understand they're at 104%. Well, Lafayette's at 85, and War Hill's at 93. Seems to me spending $2.5 million because the school board has decided they do not want to take the hard decision of redistricting, because I think when they were doing the redistricting discussions before, Powhatan Secondary from from Jamestown, put them in Lafayette, problem solved. But they would rather have the taxpayers pay $2.5 million. The other issue goes back, of course, to Bright Beginnings. Now, I don't know what it is going to take for the school board or this body here to make the school board know and understand that the problem of elementary school capacity is 100% based on Bright Beginnings and the use of those classrooms. I sent out to you all, I apologize for the fact that it went out sporadically. I made a mistake at my end. But in any event, I did a FOIA request, which I included on their capacity numbers. Clearly shows that the capacity numbers that they're using, we're actually at 78.6% of capacity at the elementary school level, if you believe that an elementary school is K through 5. The school board is of this position that is from 2 years old to 5th grade. 2 years old. Some of those kids in Bright Beginnings at 2 years old are in diapers. Now, I don't think there's anybody out there who believes that 2, 3, and 4-year-olds are elementary school kids. But they're using up a lot of 31 classrooms. And if you take those classrooms as they were intended to be for elementary school, you do not have a problem for the next beyond 2030, 31. even on their own projections, they are not going to have a capacity problem. They'll be below the 85, 90% over the next decade. In fact, why we're even having this discussion is because they've obfuscated out capacity numbers fraudulent, in my view, because they're counting 2, 3, and 4 years old as elementary school kids, and they're not. Dr. McClendon lays on me that the Bright Beginnings kids should be appropriate classrooms, that elementary school classrooms are not necessarily appropriate for that age group. And it's a point well taken, I haven't forgotten it, which is one of the talking about saving $30 million and not spending $30 million, adding Bright Beginning facilities at appropriately at existing elementary schools. That's all I have. I hope that you will remove the elementary school once and for all from the CIP, because when you put a placeholder there, it is clear from listening to the discussion of the school board, once it's on that, in any way, shape, or form on their CIP, they believe they're going to build it, which is why they keep pushing it. In fact, they want to send out folks to the Planning Commission to do a better education job on them, because last year they rated the school capacity projects as low as you can get. You got like 25 points just to get on the list, and I think they gave them 26 and was at the very bottom, and you didn't do any of that. And it's time, I think, to remove that from the CIP. And the second thing is, the future think, which I've talked about for 5 years now, is flawed. I think the planning department ought to be putting out these enrollment projections using the Weldon methodology. Thank you.
Thank you. Our next speaker is Mr. Chris Henderson.
Thank you, Mr. Chairman. Chris Henderson, 101 Keystone. Just a couple of comments with regard to the budget and some priorities perhaps that you might add or identify on your radar screens. One is with regard, the first one, and is the continuation of a theme that I began many years ago about median maintenance and beautification of James City County. We are a tourist destination. We rely, our economy, and particularly our largest employers, or several of our major employers, rely on tourists for their primary business. And I think it is incumbent upon us to present the best possible image to people who visit our community as well as those who live here, so that we might enjoy this astounding community and environment in which we live. And to see the condition of medians throughout the county during the peak summer season really is a poor reflection on James City County. As a former property owner along Monticello Avenue, I endured years where I had to personally maintain medians on Monticello, where I spent my own money and sometimes performed the work myself to deal with weeds and grass that were over 2 feet tall. If that occurred on my property, I would have been sent a notice of violation by the county for failure to maintain my property. So how is it that we have a lower standard for publicly owned property than we do for privately owned property, when in fact the public property is more visible and more in the face of our citizens and our tourists than much of the private property? It is really one of the great ironies, because I've battled this for years. I don't know why we can't come up with $100,000 per year or $200,000 per year and say that we're going to maintain our medians if the state's not going to do it. Let's simply bite the bullet and go do it. Then let's come up with a 5-year plan to landscape 199. I look at the sections of Route 199 that are maintained within the city of Williamsburg and York County, and they look drastically different than those sections that are owned and within the boundaries of James City County. Well, why is that? They made a public investment and a conscious decision to improve the appearance of our primary corridor. Why is it that we don't have the legislative will to do it? We are a wealthy community and we just simply need to do it. We need to put aside, this notion that we can't afford to do it or that there's some higher priority, because aside from police and fire, I don't think that there is. With respect to the police budget and the fire budget, I think it's going to be even more important going forward that we have a fully staffed, well-equipped, well-trained police force here in James City County. The pressures that they are under, given the socioeconomic distress, are enormous, and we must be able to support them with the full resources that they are seeking. I also want to compliment our Chief Reinheimer on his promotion to the county assistant manager position. I think it is wonderful. I am one of the chief's biggest fans and one of his biggest supporters, and I think he would tell you that. And I think he's going to do a great job in his new role. And I want to encourage the county to do a thorough search for the best possible candidate when we hire a new chief. And if we find someone like Chief Reinheimer, then we will be very fortunate, because he's done a wonderful job. And thank you for what you've done. I want to reiterate what my dear friend Mr. Everson said about Bright Beginnings and its impact on school infrastructure. We simply have to take them out of the school building equation. We can build a facility for Bright Beginnings that is significantly less expensive than a full-scale elementary school that's going to cost tens of millions of dollars. It's simply irresponsible for this body to allocate taxpayer money chasing a solution that involves that type of investment in bricks and mortar when it's simply not needed or required. Let's see. So I think that will give you some things to talk about, and I appreciate your attention. Thank you.
Thank you. All right, seeing no more speaker cards, I'll go ahead and close that public hearing, and there's no action at this time for the board. So we'll move into number 2, vacation of amendment to a subdivision plat design for allowable building area in Willow Ponds Estate, Lot 4 through 6. Ms. Rosario, how you doing today? Thank you.
Thank you, Mr. Chair and members of the board. Willow Pond Estates is a rural residential subdivision of approximately 91 acres located along Forge Road and zoned A1 General Agricultural. The plats for this subdivision were recorded in May and June of 2008. The entire property is under a conservation easement held by James City County, which addresses the uses, activities, configuration, and subdivision of the property to preserve its agricultural, forestal, scenic, and natural conservation values. The current owners of Lot 4, located at 2827 Forge Road, have requested vacation and amendment of the allowable building area designation on the plat so that they can construct a 4,200 square foot barn and a 1,980 square foot house in an area outside the currently designated area. They have proposed to replace it with a new designation for the allowable building area, which would encompass all existing and proposed buildings on the property. This is outlined in fuchsia on the second picture. Pursuant to the Code of Virginia, this change on the recorded plat needs to come before you as a vacation of the plat. As noted above, the entire subdivision is subject to a deed of easement to protect the conservation values of the property. The deed states that any permitted dwellings, buildings, or structures visible from State Route 610, Forge Road, or the Little Creek Reservoir shall be designed to minimize their visibility from said locations in any season of the year. To address concerns about any increased visibility in the new allowable building area versus the existing area, the applicant has made several design decisions to minimize the visual impact within the proposed allowable building area. First, orient the barn to shield the smaller pool house behind it. Second, to construct the structures toward the rear corner of the lot, placing the closest structure more than 1,000 feet from Forge Road. Third, to have the facade treatments of the new structure closely match the existing horse barn. The colors of the proposed barn and pool house would match that of the existing house. The applicant's architect has prepared elevations and projected scaled images which show that although the barn will be visible from Forge Road, the pool house will be shielded from view and the massing and style will be in keeping with the rural character of the community. In addition, staff has also worked with the applicant to ensure that the individual parcels and the entire property remain within the 2% impervious cover limit specified by the deed of easement. This will be ensured through an instrument of transfer to be recorded prior to the recordation of the new subdivision plat. Staff notes that the proposed vacation and amendment to revise the allowable building area does not create a conflict with past or current zoning ordinances, is consistent with the deed of easement, and is acceptable to the Willow Pond Estates Homeowners Association. Staff recommends approval of the ordinance allowing the vacation and amendment of the subdivision plat. No objections were received from adjacent property owners. I'd be happy to answer any questions at this time. The applicant is also here this
Okay, I'll go ahead and open the public hearing. Do we have any speaker cards for this public hearing? Any owners like to speak? All right, then I'll go ahead and close the public hearing and look for a motion.
Motion to approve.
Roll call, Mr. Stevens, please.
Mr. Eisenhower?
Aye.
Ms. Larson?
Aye.
Mr. McGlinnan?
Aye.
Ms. Sadler?
Aye.
Mr. Hippel?
Aye.
Motion carries.
All right. Next, we'll look at a closed session. Need a motion to enter into a closed session.
Request and directives.
Consideration of personnel matter to appoint individuals to county boards and commissions pursuant to section 2.2-3711A1 of the Code of Virginia pertaining to the Planning Commission, and discussion of a consideration of acquisition of properties for a public purpose where discussed in an open meeting would adversely affect the bargaining position, negotiating strategy of a public body, especially the property at 101 Mounts Bay Road and 297 Necklaland Road pursuant to section 2.2-3711A3 of the Code of Virginia. Motion?
Want to do the board requests and directives and reports to the county administrator before we go to that?
Let's skip over the,
Well, it's on this agenda, but it's not on.
It's not on mine.
Novus.
Yeah, Mr. Hippel, I apologize for that. We'll
Yeah.
make sure. We didn't give you good direction on your notes in front of you, so I apologize
yes.
for that.
Well, we can do that ahead of this. If y'all want to hold on this, I've read it.
Sure.
We've got a motion on it, and we'll
back.
come back for a vote. Okay. Yes, sir.
And are there any board requests and directives? Do you want to run through that? Or?
Yes. Any requests and directives?
Mr. Stevens, I would just ask, that would you please speak into what Mr. Henderson was talking about, median and primary corridor maintenance? Is it possible you could come up with some sort of a plan, because that's kind of extensive, but just an idea of what we could potentially do in a budgeted amount of something that we could address to this, because I get complaints about it as well. I know, especially like in the area in front of Thomas Nelson and Harris Teeter, I mean, it's like tentacles of weeds that go out into the road, and by the time VDOT gets there, and then they make the circle, it's no time at all before it's knee-high. So that's, another example of one of those areas. So is it possible you could come up with some sort of an idea for us of what we could look at with that?
Yes, ma'am. I will. Probably a couple things to do. The board has put several $100,000 towards these kinds of efforts already, and so we could develop more plan. It's just how far do you go and how much money do we put into it? Because you do put money into litter pickup, you do put money into mowing, and we have a contractor that we pay to mow. We have VDOT doing extra mowings. So, but I'll be happy to bring what we're doing, and then we can talk about how to reach more areas. Because I would agree, there are areas that still are unsightly and really don't represent our community well. And while they're not really our responsibility, I think the likelihood of having VDOT put more resource towards it is unlikely. And if we're going to make them better, it probably is local funding that's going to help with that. So we'll have that discussion as part of either a retreat or a budget process in terms of going forward, but be happy to do that.
Thank you very much. I appreciate it.
There's two items. One, I had brought this up to Mr. Peirce, but from Mr. Stevens as well. I would like us to get back on a regular schedule, if we can, of having VDOT come to our work sessions on a quarterly basis. So if we can try to, set that up so that we have it pretty well ironed out for the whole year, I think it'll give us a better opportunity to tackle some of these particular issues with VDOT on a more frequent basis. And the second thing is, I got an email from a constituent who was very interested in litter and cleanup. And Mr. Kevin O'Donnell, who lives in Ford's Colony, I don't know whether he's your constituent or my constituent, whether he's in Jamestown or Powhatan, but I've made every attempt to try to recruit him to be on the Clean County Commission. So maybe we will get one from Powhatan.
I'm hoping.
And as I came to the meeting today, I believe I saw his car parked out at the gate, and he was out working along News Road with one of those litter pickup kits that Peg had given him. So we need to get more folks like that really involved, and I want to congratulate him on his willingness to become involved and help the county. Thank you.
Thank you. Anything else?
Finished for the. Okay. So I am going to second the median issue, or third it, excuse me. And I do appreciate that we've given money, but obviously there is an issue at VDOT that, Monticello he's right. Neighbors would be calling to get their neighbors' lawn mowed if it were that tall. I realize we get a lot of rain. We've had a wet year. I get it, but we are a tourism economy. Is there something we can do? Is there something VDOT will do? I appreciate what we've done in the past. I will go back. I was in Christiansburg this past weekend. Beautiful median, getting ready to turn, sponsored by a business. I've brought that up a couple of times now. Is that something that we might get some interest in, that a business might be interested in? I don't know if you've ever been to Lynchburg. Their medians, their exits are beautiful. They're sponsored. I know that takes somebody doing that. I'm happy to do it, but I do think that's something that we need to work on. I did want to take a moment about last week. It was horrible, and I'm so very sorry for the Capitol Police that have passed away and the law enforcement that had to deal with that. I watched a video yesterday that about made me sick to my stomach, a man getting beat with the American flag. And so I urge anybody that, the FBI is doing an excellent job on putting out pictures and, help them find people and bring justice. I do think that we are at a pivotal point in our country. We are a divided country. If you just talk about votes alone. So it's my hope that we can all start listening and working with one another. If more people in the federal government had to work on the local government first, I think it would look a little different, because you have to get along when there's 5 of you. And you have to work towards consensus on something, or nothing will ever move forward. So I do hope that they can continue to move forward. I want to say a positive. I want to say something about Brad first before I talk about the vaccines, because I think this is it for Brad. This is his last meeting as our police chief.
Yes, ma'am. I plan to bring him up and introduce him, and whether you want to hold comments or
you are going to do that?
I do plan to do that as part of my comments this evening, but whichever
right.
place works for you.
I'll wait then. I'm hesitant to say anything after our presentation tonight about the vaccines, because I am underwhelmed. I don't know about the 4 of you. I am getting beat up every day from people who have done what they're supposed to do since last March. They were led to believe the vaccine was going to be, you know, and I understand what you're saying too. It's not just, we got to keep doing what we're doing. It's not that I don't think people are like, give me the vaccine and I can go back to normal, but it is working its way to normalcy. I don't see a plan. 1,000 vaccines. Oh, we're going to get school nurses. Oh, we're going to get EMS. I'd like to, you know, I'd like to pull the chief up here and say, hey, has anybody called the James City County Fire Department to get EMS? Where was the planning? You know, I don't know. I think, you know, I hear federal level gave it to the states. The states don't have the infrastructure. They don't have the plan to do it. Somebody, let's go. You know, people are counting on this vaccine, and 1,000 people is just not enough at this juncture. Supervisor McGlinnan is right. There are counties moving into 1B. There's like 11 of them that were announced today. And people look to us. They do not look to the health department. And so we have to find a way to work better with the health department. I don't think they really want our input, probably, but I don't know if we need to go to our state representatives. I've tweeted when it came out that, you know, we were going to start looking at legalizing marijuana this week. I said, how about we start looking at getting everybody a vaccine first? I just think this should be job one right now. As long as we have the vaccines. I realize that, you know, there is a supply chain, but if we've got vaccines, let's start getting them into arms. And, you know, I'm telling you, we're a tourism. Can we do another summer like we did? That vaccine will help us move forward with our economy. It'll help us get our schools back open. We really need some cooperation here. And while I appreciate the health department's willingness to come here to our meeting, I do not feel much better than I did at the beginning of this meeting. And I'm very, very frustrated. So, thank you.
A couple of things that I'd like to mention. First is that 4 days before Christmas, I had the privilege of presiding over a ribbon cutting on Pocahontas Trail, a Habitat for Humanity home that has been purchased by Charlita Pittman. Ms. Pittman is an employee of Walmart Distribution Center, so she will be very close to her new home, or her place of work from her new home. She has 3 children. 2 of whom are currently in our county schools, and one of whom is not quite there yet, but will be soon. So I congratulate them. Ms. Pittman put in a lot of hours. I got to go to the wall raising earlier this year, and then it was great to see the finished product as she moved in. I also did want to make mention of the passing of a distinguished citizen, a resident of Kingsmill, Ann Kahn. Ann retired to Williamsburg to be close to her family, Nancy Bolash and her family. Ann previously had served on the Fairfax County School Board and was also national president of the PTA in the 1980s. And so I think we recognize that she had a distinguished career before coming to James City County, continued in various volunteer activities when she got here, and will leave behind a family that continues that legacy of service. I wanted to also give my thanks to county staff, especially I've put some special burdens on our Director of Development Management, our Stormwater Director, one of our planning staff, our engineering crew, dealing with some neighborhood issues, and they have just been unfailingly polite, helpful, and creative in thinking about these issues. And so I wanted to thank them very much for that. And I did want to reflect just for a moment about the issue in Washington. And I wish I could say I had the confidence that Ms. Larson has about local government service, because frankly, there are people in local government who are serving in Congress now, who have previously served in local government, that are very disappointing to me in terms of the way that they have behaved in this situation. I will say that it was a little disconcerting for me to hear, on the one hand, a rejection of the violence that occurred last week, which I applaud, but then a repetition of allegations that have been proven to be false. And that's really where the problem begins, that we have people who are willing to spread untrue statements about the nature of our electoral process and suggest at a very time when our Department of Justice, when the head of cybersecurity for the nation, and others are pointing to the actual efficiency and success in maintaining a free and fair election this year, to continue to suggest, as the president has been doing, that this election was in some ways stolen, simply creates the environment which encourages the kind of violence that we saw last week. And so I think it is important for us to recognize that, yes, our own county's elections were very cleanly run, very efficient, very effective, but that's the story across the country, and it is important for us to recognize that and to stand up to those who would say that there is something amiss in our electoral system and that in some way or another the election was not conducted fairly. So I'll leave it with that.
Could I follow up with that, please?
You certainly may.
I appreciate your comments. I will say that I think there's room for blame for what happened on both sides. I think it was horrendous. But I will say that I'm one of those people that likes to, sorry, I can't talk with these things, that likes to get into the weeds about some things. And I watched tens and I mean, I bet I can't tell you how many hours of testimony that I watched from citizens who got up. And part of the problem is that our news is not reporting everything. I watched it online. I watched hearings in Georgia. I watched them in Arizona. I watched them in Pennsylvania. I've seen them in Michigan. I've seen them all over. One day, I bet I cleaned out 10 closets listening to hearings. And to dismiss the allegations that have been brought forward of affidavits, sworn affidavits, penalty of perjury, of citizen, excuse me, it's my turn, excuse me. Sworn affidavits of citizens who participated in the process. They participated in the process. They witnessed and witnessed and witnessed. And I think that's been part of the frustration. There's been a lot of things that's out there. And I'm with you, Mr. McGlynn. I thank the good Lord that we have Miss Mormon and that we live in James City County, but to dismiss, stacks and stacks of affidavits from around the country of citizens who have volunteered their time to participate in the process is a little bit, it's a little bit much. So there's evidence that's out there. It's not been reported. And that's unfortunately, I think that probably led to a lot of frustration the other day, but the evidence is there. They do have it, but it's just not being heard and it's not being reported on. So to the citizens who do volunteer in our electoral process and with everything else that people volunteer for around, in our communities, we thank you. We thank you for taking a stand. We thank you for being a good witness and being part of the process. And I think we all have to acknowledge there's bad players on both sides, on all sides. So it's unfortunate. It was sad. And when we said our Pledge of Allegiance this evening, I was in tears. I am scared for my grandchildren of what they're getting ready to do, because I know a lot of people that have been pulled off. My grandsons called me old. They're like, Grammy, only old people do Facebook. I'm like, okay, well, I'm old. But that's how I stay in contact with a lot of my friends. And for people to be kicked off and all this big tech nonsense that's going on and the censorship, You know, people, it's scaring people. It's scaring people. So I hope we can all, both sides of the aisle, learn to, kudos to this board for working so well together. But I think we need to take positions from whatever party we belong to, reach out to our state representatives and reach out to our federal representatives and beg them, as Ms. Larson said, to work together as we do. I think that that's going to be the salvation of this republic if we can keep it. So I think that you know, I don't have access to everybody that's elected that represents us, but I do a few, and I'm just begging people, just get along. I said, look at our board as an example. Do we always agree? No, but we're respectful and we get along. So I implore our state and federal electeds, to Ms. Larson's point, to work together and to do it in a more respectful way. Thank you, Mr. Chair.
And Mr. Chair, I'm just going to finish. I'm not going to belabor this point. I certainly respect Ms. Sadler's opinion on this, except for the fact that those affidavits that were presented in legislative hearings did not find their way into court hearings because people were not willing to attest to their veracity.
That's because they were being threatened with their lives.
There were judges that were appointed by President Trump who threw out cases because there was no evidence presented. And the fact that so many, including the president's own Justice Department, said that this was a free and fair election among the most honest ever conducted, suggests that there is a need to grapple with the truth. And that's all I'm suggesting here. And so
Thank you. Well, I have my own opinion about the DOJ, the CIA, the FBI, and all the other alphabet organizations, but we'll just leave it at that because we all get along here. So thank you.
Well, I'm gonna roll us all back in, and because I've seen it in the past where this board issues came up, not this group, but other groups, and it became a thorn that festered. What happened in Washington is a shame, and it should never happen, but it should not happen on our streets and our communities. That's happened through this past year. We've had a rotten year this past year. No ifs, ands, buts about it. Tearing up communities, tearing up towns, tearing up the Capitol, tearing up everything. When did we lose our sight as human beings and as Americans? When did we lose that sight? Our fathers would be embarrassed on what's going on right now. Whether you agree with one thing or the other, who lied, who didn't lie, I always find there's an ounce of truth in every lie that's ever told. It starts out somewhere. And I know this board has always been dedicated and hardworking for the community in James City County. I can't fix Washington. I don't know if anybody can fix Washington, all of them up there. And but I know I can do something in my community. And maybe that's where it starts. And maybe by showing what we can do as a diverse group in our community, regardless of what goes on around us, we may be the light that the nation needs. And we may be the ones that step forward. And we may be the ones that cut that path and move things forward. That's where things start. And we've already done it. We just need to continue doing it, and all the other stuff that goes on around us. Yes, it's heartbreaking and it's nerve-wracking, and there's sides of this and that, but we have a job to do in James City County, and we're damn good at it. Oh, excuse my language. Scratch that on TV. And that's a nickel in my jar at home, my wife said. So we are good at what we do, and we're going to concentrate on James City County and what we can do as a group. And it's all the differences that we share that gives us the right opinions and the right moves to move the community forward.
Amen.
So, and I also want to, as Dr. McGlennon said, I had staff doing a few things for a few citizens for me, and it's amazing what they were able to do. Paul Holt and his group met several times out on scene, Jason and everyone, and all the stuff that was done to help some of the citizens and get around some of the issues that, well, this doesn't work, but you can do this. we can move this way and we can do that. So I want to say thanks for the staff and what they've done there. And there's always room for improvement, but they're doing a great job and we're improving every day. We lost another member of our community, David Hooker, and his family had done a huge amount of stuff for the community over the years, and donated a lot of things, did a lot of events as far as, you know, if there were natural disasters and that sort of thing. And our prayers and thoughts go out to his family for the loss to him this past week. So other than that, I think that takes care of everything. And next, I'll go to the county administrator, Mr. Stevens. Your turn.
Thank you, Mr. Chairman. I do want to follow up on vaccines and sort of the status and to address some of Ms. Larson's concern. We as staff are getting a lot of questions, as are you, about when residents can expect to receive vaccination. I will tell you the Hampton Roads, city managers, county administrators, and emergency management staffs have been talking about these issues for months. We have been very engaged and very involved in talking with our health department. More local to us, the Peninsula managers and county administrators and emergency managers are all talking as well. In the last several weeks, we have had numerous calls, and I do think we are making progress. There's a working group of managers that was put together to write a letter to the state. We have requested a meeting with the doctor that was assigned from Richmond to sort of lead the vaccination. That meeting will occur on Friday. There are a lot of concerns in terms of offering our EMS. We have been offering our EMS staff, and the determination is, yes, we can administer vaccinations to our staffs. The concern is, can we administer them to the general public? And I think if the health department asks us to do that, then we can, in fact, do that, administer those to the public as well when the vaccinations are available. So I think you will see more going. I will say our hospital systems have been very good at reaching out and trying to set up clinics. We are not there yet, but there's a lot of good conversation there, trying to build on what the health department's doing and trying to expand their capacity. And I do think to give hope that we will get there. It's a lot of conversations and we are behind, but there's a lot of effort trying to make it better for our region. And it is important. It's important to me. I know it's important to each of you. And that exists through our other localities along the peninsula. So I do believe that will get better. Our emergency managers are very involved in the process. And again, I expect we'll have some good news that we can share in the near future about other sites and ways to get there and how do you get an appointment. But I just want to reassure you in the community, there are a lot of good conversations. In terms of our staff, we have vaccinated close to 50 of our staff members that have been done in the past week. We have another 25 that are scheduled. I think that will move more. The social services staff, a lot of those are recognized as being in that 1A group where they were not initially. So we will have those being scheduled, I think, very soon. And then we'll move into other groups within our employee base that are 1B and others, which will be law enforcement, school teachers, and those other critical groups to getting us back to normal. So I just want to reiterate that I do believe we'll have progress to share with you. It is frustrating to us as well, and we are trying to work with the health department to get us there.
Can I ask a
yes,
question? One, I know there's been some talk about, I know grocery has been listed. I did have somebody that worked at Target ask me because they've been, they feel as though while they're not grocery, they're retail, they fall in one of those categories. As maybe if we could get a little bit more clarification.
I'll be happy to ask that.
And then, I realize we got to move forward, but, we just don't know. We had a pandemic in 1918, and I get, we've had a couple since, but not at this scale. So I do think it's important to ask questions so that we don't find ourselves, like one for me is, why weren't we ordering refrigeration prior to now? Like, when we knew that was going to be, I've been hearing that for months with the Pfizer vaccine, that this is what it was going to need. So, there was federal CARES money. Was the state on that? And I don't know, maybe they were, maybe that's something you can find out. But I do think we have to look backwards to help us do better in the future.
Right.
So.
Ms. Larson, I think it's like a lot of things. We couldn't get these for a long time. Now we have a plentiful supply of them. What I heard with the coolers, because we were talking about coolers, I believe, last summer, and they were ramping up production. There were businesses that were expanding their capacity, but it wasn't needed in just James City. It was needed across the country and really across the globe. And so the demand or the supply issue hadn't met the demand yet. I think it will catch up, but I don't want to say the health department in that sense didn't recognize the need, and we can clarify and
Sure.
confirm where they were. But
Okay.
I really think it's a supply issue on some of those things that all of a sudden, we only needed this many before, now we need almost an unlimited amount so we can get the distribution out. So I do think it will catch up, but it is frustrating that some of these things on our side weren't done sooner. And then there are other things that I think really are supply and logistics, and the manufacturing just hadn't ramped up to it. But
Thank you.
I do think it'll get better. When Dr. Dwamena talked about 1,000 vaccinations being given, I think that must be what has come through the health department.
Yes.
That doesn't include the hospital systems that are doing
Said
vaccinations as well.
4,000.
Okay, and then our numbers within the region, I think, on the websites are close to 7,000 from Hampton, which is a different health district, but still her responsibility, into Newport News and us. So I think those numbers will get better as we go forward, but it's not just the 1,000 that was represented. So we'll continue to try to update you on vaccinations and where we are as things move forward. The second item I have, Mr. Chairman, is I would like to ask Chief Reinheimer if he'll come forward and stand at the podium, so those that may not be aware of who he is will at least know who I'm speaking with. He was here a minute ago. Excellent. This may be one of the last times we see him in uniform, but I do want to take a moment to publicly recognize and congratulate Chief Brad Reinheimer as our new Assistant County Administrator that will be responsible for social services, police, and fire. Most of you know Chief Reinheimer as our police chief who has served James City County community for more than 25 years. And I'm really delighted that he was interested in serving the community in this new role. I think it'll be a challenge for him, but I think it'll be good for him, and I think it will be good for our community to have him in that role going forward. Prior to coming to work for James City County, and you learn something about people as you go through time and do these kinds of things, prior to his 25 years here, he was a nuclear machinist mate with the U.S. Navy, so I want to thank you for your service there, and was honorably discharged in 1995. Chief Reinheimer holds a bachelor's degree in criminology from St. Leo University and a Master of Science in Criminal Justice from the University of Cincinnati. He is someone well known by the Board of Supervisors, our executive leadership team, and in the community. And through his active involvement with regional and statewide associations, he is well known and has contacts throughout Virginia. He brings a calming presence, a common sense approach to problem solving, and is willing to work for this community. So I believe Chief Reinheimer will strengthen our ability to prepare for the future and to improve our community outreach efforts. I do want to congratulate him again and look forward to working more closely with him on community-related issues. I would ask the Chief just say something, and then we'll see if you have any comments or things you'd like to throw at him.
I'll be brief. Thank you. Thank you very much. And it truly has been a tremendous honor and a privilege to work here for the past 25 years. And, waking up every day and putting on this badge and this uniform it's really an honor. Thoroughly enjoyed serving our citizens and this community. Hard to let it go. But it's exciting to look forward at this new challenge, and I'm blessed to have this opportunity. I thank Mr. Stevens for giving me that and the confidence that he has in me, and I truly will strive to do the best possible job that I can for you and for our citizens. I love this community. It's why I moved here, and it's why I continue to live here, and that's my goal, to make this community even better, and I hope to do that, and I look forward to working with you all in the future.
Any comments?
Welcome aboard.
Now's your chance.
Well, I just think it's a great tribute to you that you've been selected for this position, and certainly it reflects well in the record that you put in place as our police chief and as a member of the force for years. It's been clear to me that you have a very very skilled way of dealing with people across all of the county spectrum, and give them a sense that is true, that you are listening and understanding their perspective and trying to understand their perspective, and then processing that in a way that gives them a better level of confidence in our law enforcement. And now I know you'll do that for the county as a whole as we move forward. So congratulations and thank you.
Thank you for your service in the police department and as chief of the police department. And you've done an excellent job. Can't wait to see what you do with the next part of your career. And so that gives us another 25 years.
Hopefully.
There you go.
I do want to thank you. I think we are very fortunate to have Chief Ash as the head of our fire EMS and to have you as our police chief. That's probably my one little, I'm really excited to work with you over on this side. And I also, I think that took some courage to try something new, on your part as well. So I'm really looking forward to what you're going to bring over here, but I will miss you at the police, leading the police, because I've always thought a lot of you and your leadership style. And that was even more evident this past summer when we were faced with something that was happening on the national level. And you went out and listened to citizens that were frustrated and felt unlistened to. And you worked with your department to make sure that we had peaceful demonstrations here, but allowed them to happen. And there's still work to do in that area, and I think you will bring that here as well. So, I mean, it's gonna be hard shoes to fill over on the other side. So I did want to thank you for your leadership with our police, and look forward to working with you over here.
Thank you, Chief. All right, now,
Oh, the motion for the
Okay.
closed session.
all right. We don't have to read that all again, so we'll go with that. And we have a motion. Roll call, please.
Ms. Sadler?
Aye.
Mr. Eisenhower?
Aye.
Ms. Larson?
Aye.
Mr. McGlinnan?
Aye.
Mr. Ripp?
Aye.
Motion carries.
Okay. We're in closed session. Let's bring this back in, and I need a certification.
Yes, Mr. Chairman, I move to certify that we only discuss those items we indicated we would talk about.
All right, thank you. Roll call, please, sir.
Ms. Sadler? Aye. Mr. Eisenhower?
Aye.
Ms. Larson?
Aye.
Mr. McGlinnan?
Aye.
Mr. Hippel?
Aye.
Motion carries.
Hey, I would like to make a motion to do 2 appointees to the Planning Commission. First, Jack Haldeman from the Berkeley District, and he will be appointed for a term expiring January 31st, 2025. And as the at-large member, Tim O'Connor, who would have the same term.
All right. We have a motion. Roll call, please, sir.
Ms. Sadler?
Aye.
Mr. Eisenhower?
Aye.
Ms. Larson?
Aye.
Mr. McGlinnan?
Aye.
Mr. Hippel?
Aye.
Motion carries.
Okay. Moves in now, we'll need to have an amendment to adopt the calendar for our Charge 2021.
Our Charge 2021.
I almost said retreat. Sorry about that. See, I'm
January,
learning.
I didn't
has more
hear,
than one meeting.
I didn't hear from anybody, so January 30, 9 a.m.?
Right, there it
Okay,
is.
all right.
It's at the JCSA.
Yes, we'll firm that up, but that, yes, it is now at JCSA.
Okay. I need a motion for that.
So moved.
So, roll call?
Ms. Sadler?
Aye.
Mr. Eisenhower?
Aye.
Ms. Larson?
Aye.
Mr. McGlinnan?
Aye.
Mr. Hippel?
Aye.
Mr. Chairman, just for clarification, that was to amend your calendar to add a meeting for January the 30th at 9 a.m. at the JCSA Operations Building, correct? Sir. Okay.
All right. So, now I need a motion for adjournment.
Did you want to recognize our citizen, former member of our planning commission? Would you like to say
Yes,
a
I
word?
would. Mike Maddox passed away, and we'd like to say our deepest sympathy to his family. And he served James City County tremendously in his time here. It was a joy to have him in the community and in the county, and all the work that he did for James City County is very much appreciated. And we wish blessings on the family and our heartfelt sorrows to their loss.
And I'll move for adjournment till 1 p.m. on January 26, 2021 for our work session.
Okay, motion?
Ms. Sadler?
Aye.
Mr. Eisenhower?
Aye.
Ms. Larson?
Aye.
Mr. McGlinnan?
Aye.
Mr. Hippel?
Aye.
Motion carries.
We're good. Be safe out there.